everybody, and welcome back to Healthtech Pigeon podcast, where we dissect and discuss the latest health tech news so you don't have to. I'm Amy Thomas, and with me today is SomX's Belle Taylor.
Hi.
Hello, Belle. And Adama Barry on producer duties. Thank you, Adama. And we are delighted to be joined today by Tom Hardie, who is the Senior Improvement Fellow at the Health Foundation. A very warm welcome, Tom, and yeah, great to have you on the podcast. So Tom has a policy background, having worked within Department of Health and Social Care and the NHS itself, and then in recent years at the Health Foundation. But we look forward to hearing from Tom a little bit more on his background and the work that he's been doing. Just a bit of context, though, before we launch into the details. Earlier this month, the Health Foundation published a report titled Digitizing the NHS and Adult Social Care. Big topic, to say the least. And our guest, Tom, was one of the authors. So, Tom, before we get into the details of the reports, do you want to give our listeners just a little bit of background on you and some top lines from the reports? And then we're going to dive in with some questions, if that's okay.
Yeah, hi. Yeah, that sounds great. So yeah, as you said, been working in healthcare for over 10 years now, in policy and research roles. I currently work at the Health Foundation, as you mentioned, and we're a UK focused organization working to build a healthier country, and we cover a whole kind of range of areas. But within that, one of the topics that is particularly interesting for us and we're focusing very heavily on is innovation, and within that, technology, data, artificial intelligence as well, because we see a lot of potential for using technology to help the NHS and social care meet the challenges that they face in the 21st century. And as part of that, one of the things that we've been keen to explore is how we digitize the NHS and social care. And, as listeners may have seen, there have been quite a few reports over the years about progress on digitization within the NHS and social care. And there's a whole kind of range of reasons why we haven't kind of got to the place we want to in terms of digitization. But one of the kind of key contributing factors to progress not being as fast as we'd like is funding. And so we were really keen to explore the question, what would it cost, what could it cost to digitize the NHS and social care? And so we spent the last year and a bit exploring that question, working with PA Consulting. And there are kind of three top line findings from that I'd love to get into more detail with you on. One of them is that it's going to cost around, or it could cost around 21 billion over the next 5 years to digitize the NHS and adult social care in the UK. And within that, that's around 14.75 billion for England. And that includes investment for the kit, but also for the change work that's going to be absolutely critical if we want to get the benefits out of technology. So that's implementation and maintenance and improvement over time. The other really important finding here is that within that investment that could be required, what it showed was there's still a big requirement for getting the basics right, which we hear a lot about when we look at health tech. So that's the kind of basic building blocks of digitization, including things like electronic patient records, foundational kind of technical components like networks and connectivity, data centers, cloud hosting, and so on. And then corporate IT, so covering kind of internal systems for business functions like HR and finance. And actually, across those kind of building blocks of digitization, they accounted for half of the estimation that we found in the research. And then the final thing I just wanted to mention was that, when we look ahead, and we're at that pivotal moment where we're about to see the 10-year plan, we've got the spending review coming up. To get digitization right in the future and achieve, the government's goals of shifting from analog to digital, the government really needs to not only provide the kind of necessary funding, but also set out a clear long-term vision for digitization and a plan for achieving the benefits. And we think those things are going to be really critical to get right.
Thanks so much, Tom. Some really interesting points there, which I'm sure we can dive into a little deeper. One is on the basic building blocks aspect that you mentioned, which I thought was a really interesting part of this report. There's a line in there that actually says, while attention is often focused on the cutting edge possibilities of digital technologies, this analysis underscores that significant investment is still required to ensure the basic building blocks of digitization. So I think that's really interesting, I guess, from a maybe from that wider perspective of there's a lot of attention on how we build how we build these technologies into the NHS, these technologies that seem very groundbreaking that are going to transform things, but perhaps less of a spotlight on the other kinds of technologies that are really there on a process level. What are your thoughts on how do we need more spotlight on that? And how does that impact potentially the private sector or startups that might be working in those areas? Or is that a problem? Not necessarily a problem, but is that something that the NHS needs to focus on itself? How do you see those basic building blocks and some of the issues there?
I think they're really critical to get right, and I think anyone that's working in health tech or in the NHS will know that we're not quite where we want to be with having the basics in place. We still hear about um, Wi-Fi connectivity being poor in different parts of the NHS estate. We hear about computers taking ages to switch on and multiple logins, still using pages that are held together by elastic bands. I mean, these are kind of extreme examples, but I think they just highlight the issue of how we still need to go a bit further to get those basic building blocks in place. And more advanced technologies are also really important. And there's rightly a lot of focus on artificial intelligence, and we need to get ourselves in a position where we can capitalize on that and reap the benefits in a responsible way in the NHS. But we're not going to be able to do that if we don't have the basics in place. And I was speaking to somebody who works a lot on AI recently, and he made a great point, which is like, these basics, they're boring, but they're like paying your bills. You need to do it, and without that, how are we going to bring in more advanced technologies which require particular sets of hardware and software that require certain processing power and so on. So I think you know the NHS and policymakers that set the direction for NHS and hold the purse strings do need to take this seriously and invest in those building blocks. But I think one thing that is important to note that came out of this project, that it's not just about the kit, it's not just about the technology itself, it's also about how it's implemented, and it's also about how it's iterated and improved over time, because without those two things you're not going to get the benefits. And I think looking at reviews of progress on digitization over the last 10 years, the implementation and optimization bit has been neglected, and it's not always received the funding and the support that it needs. And this isn't just about the building blocks, it's about any kind of technology. You need to not only invest in the technology, but also in the change, which can take time, right? You're not going to achieve the benefits immediately. It takes time to get those in place. So um, I think there's a lot of focus that needs to be placed on this within NHS organisations themselves, but also in national bodies like the Department of Health and Social Care and NHS England and others.
Fascinating. And what stood out to me, and I'm interested to hear Belle's thoughts as well on this. If you want to chip in, Belle, um, that benefits piece that you mentioned, it's clear from the report that funding is needed, quite a large amount that you mentioned at the beginning. And is there more work to be done on the benefits side? Do you think people understand how those benefits are going to be achieved, and what kind of position are we in to kind of communicate that to the people that need to hear it?
It's a good question. This is certainly something that we've highlighted in the report, that you know government and policymakers do need to set out a plan for how the NHS is going to achieve the benefits of technology. And I think without that, NHS organisations that are implementing technology may struggle to achieve the benefits. Um, and I think electronic records are a really good kind of case in point, because they're a really critical part of digitisation. But other research that we've done at the foundation shows that the purchase and implementation of EPRs is just the start, and actually, if you want to get more advanced functionality out of electronic health records and you want to get them working effectively, then it requires a plan for achieving those benefits and quite extensive work to get them to materialize. And when we look at the US, who are further ahead than we are with things like electronic patient records, that shows the kind of work that you need to go through um, to be able to achieve the benefits. So we think that having a plan for achieving those benefits could be helpful for the NHS, so they know how to do this work and how to kind of get those benefits to materialize.
I think so often the perceived barrier to this change is the thing that people have to get over, and it's demonstrating, like you say, clearly what the value is up front, so that you do get that buy-in at a healthcare level. Because without that buy-in, then with the best technology, then you're not going to see that change happen, even if the policies exist. So I think that's a really key piece. And coming back to this sort of getting the basics right, I think you're right. Electronic health records are, such a great example of that. And I think as well, it's not just clinician buy-in that we should care about, but it's also patient buy-in. And patients need to feel that their healthcare systems are getting the basics right before they're adding in all the sort of shiny things around the edges. Because if they go to, they move district or region and there's no record of their health history, and they have to say it all again to different doctors when they get referred to people, that's a strain on them, which just feels like something that should be fixed. And then if someone came in and said, we've got this great AI, it's like, well, that's all well and good, but you haven't done the bare minimum that's going to make my experience easier. So I think that basics piece is so important for both the patient side and also the clinician side, and the plan as well. And let's not forget, fax machines were cutting edge technology once. So that piece you say about ensuring we are actually optimizing over time is so, so valuable as well. We'll look back on these technologies through the lens of what were we thinking? Why haven't we changed? So it's really important that we're future proofing from the beginning, so that we're continuing to provide value for people and they're not feeling that these are just technologies that are making their life harder.
It's funny you mentioned the fax machines. That's actually one of my questions I wrote down. Are there many trusts still using fax machines and pages? Was a question I didn't quite get to, but yeah, it's a good point. And actually, just one sort of maybe final point before we move on to the next story. We this piece and we often talk about this shift from analog to digital. Where at what point do we say that that shift is complete? And would we say that the shift is already, it's already happening? I'm interested to hear your thoughts on that, Tom and Belle.
Yeah, it's a great question. I wonder how Wes Streeting would answer this, and what kind of threshold he's setting. I don't know, but I mean, I think what we'd say is that in a way it's okay. There's some basics that we need to get right, and there's a sort of critical level of digitization we need to achieve. But really, it's not a destination. It's more of a journey, isn't it? Because what we're trying to do is improve the digital capabilities of the NHS and social care over time, and that's never going to end, is it? Because there's always going to be room for improvement. Um, but I think through this project, we were looking at some kind of what we would describe as core elements of digitization. You know, we've talked about EPRs, we've talked about networks and connectivity, software and hardware, cloud hosting, data centers. Um, Corporate IT, so HR functions, finance functions work effectively. Staff have got the ability to collaborate virtually. So there's all that kind of internal stuff that helps the NHS operate effectively. But then there's this sort of patient-facing side. So, like, remote monitoring technologies are becoming a bigger focus for the NHS because they can provide convenience and and allow clinicians to monitor patients from afar. So there's that aspect. There's also the kind of information aspect and allowing patients to be able to get health information electronically, make bookings, order repeat prescriptions, etc. And actually, in a lot of places, this is in place. You know, there's there's a way to go to optimize those things and make sure they're working really effectively. And I think that takes us back to one of the key messages from this piece of work, which is it's not just about buying the technology. It's also about making sure that it's working effectively. And we think that bit needs more focus than it's had to date. And if we can really get that bit right, then we're going to be in a better position to achieve the benefits.
Nice, strong message there. Thanks, Tom. I think that leads us nicely into the next story. Let's move on to our story number 2, which is, can AI therapists really be an alternative to human help? Um, Very interesting piece from the BBC, and it has a range of perspectives, which I think is quite nice in this piece, from the patient themselves using AI and chatbots for mental health support, um, then also having views from psychologists and clinicians, and also from the CEO of Wiser, which is a AI mental health service chatbot himself, like from the corporate side. So lots of questions to dig into, which actually links to some of the stuff we've already been talking about using technology and, as Belle mentioned, the actual end user of that, the patient themselves. So yeah, Tom, interested to hear why you chose this story and initially some thoughts. Can AI be a replacement to therapy? And what are your thoughts on that?
Thank you. Yeah, I mean, this is such a fascinating story, isn't it? And it's so topical because it draws on so many kind of interesting questions around the role of AI in healthcare, the role of the human in healthcare, um, safety, effectiveness, and a bunch of other issues. I mean, you know, for me, this article underlines that we have a big challenge with access to healthcare services, right? Particularly to mental health support and advice. A lot of people need that kind of support, but they're having to wait ages to get it. So I think it's logical that people are going to be looking to technology to maybe try and fill that gap. And we spend a lot of time looking at AI, doing research into what people think about AI and what the potential is. And clearly there's some circumstances where um, AI chatbots are going to be helpful. And in the context of mental health, maybe that could be helping a mental health practitioner monitor their patient between clinics. But I think, the other thing that comes out of this article is that clearly there's some big concerns about safety that we really need to take seriously. And then for me, that leads to two questions. The first one is about safeguards and ensuring that technologies like this that provide direct advice or could provide direct advice are developed and tested against rigorous standards. And we've got a whole kind of regulatory regime governing software as a medical device. Um, but I think, with large language models, there's a range of ways that they could be used that probably do fall into the category of medical device, but they haven't actually been through regulatory approval. So there's a whole bunch of risks there that we're actually looking into at the Health Foundation. So that's one question around safeguards. But then the second question this article raises for me is around what is actually acceptable to users. And that's really important because we know that public and staff support is going to be really important for implementing health tech more widely. In other words, if we don't have a critical mass of support for health tech, it's going to be really hard to get it adopted at scale.
You're right. This is a fascinating article, and it really does tap into a lot of different areas, which I'm sure many of us can, relate to, having used chatbots and various LLMs for different things. Um, I think what's really interesting is the safety concern, but also the view from um, Hamed had, I won't actually try and pronounce his name. He's a professor of human-centered systems at Imperial College, and actually talking about the LLMs themselves, and what they're capable of. He likens the chatbots to an inexperienced therapist and points out that humans with decades of experience will be able to engage and read their patient based on many things, while bots, they go on the text alone. So I think that point about realizing what the technology can do and what its limitations are really important in how we implement this, and safety around, if patients are really getting the value from it. Belle, do you have any thoughts? What do you think about chatbots for therapy?
Yeah, I do. I think it's so fascinating, this discussion, and you see such need for it. I think particularly when you think of mental health waiting lists in the UK, I think they mentioned in the article there are 426,000 mental health referrals last year, which is a crazy, crazy number. So we've got these massively growing waiting lists of patients that are trying to seek clinical or professional support for mental health, and they're having to wait for that support to come to fruition. And I think something that we also know with mental health is that period of waiting can often lead to a worsening of symptoms, of people feeling worse and feeling unsupported. So these kind of virtual or digital AI based chatbots give a stopgap. I think they, in the article, they use the term a stopgap for these long waiting lists, but they do provide a sort of really vital intermediary role when someone is looking to kind of seek that extra support but is unable to get it yet. So I think we cannot rule out that there's a really positive and impactful role that they can play here. That being said, I totally agree with both of you. There are so many things that we need to be careful of, and I think ChatGPT is getting new models every week. I think recently they had to recall a model because it was basically agreeing with everything you fed into it. Now, if you imagine that you're using ChatGPT to kind of tell it your mental health problems and ask for advice and support, and it's just agreeing with you. What if you could be very low? There are examples in here of someone who tried to take their life. You cannot rely on a chatbot to give you the correct advice. That needs a real specialist to advise with that. So I think, Tom, you're absolutely right. It opens a wormholes of where is the regulatory guidance here? Because if you are giving medical advice, then we should be holding it to the same standards that we hold all our other medical advices to, which is strong regulations. So I think, yeah, there are really positive things here. Um, I also think another positive element is not just the waiting list. And we talk about this in other scenarios with how digital health can be helpful to some people, but especially with problems that may be internalized with mental health issues, sometimes people are embarrassed, they feel shame, they're very private. These are things that they don't necessarily feel confident or comfortable talking to a clinical person about because they feel embarrassed about it, or they just feel like it's not actually a big problem because they've been made in the past to feel that mental health shouldn't be something which they should seek advice for. There's so many complex things at play which can stop people seeking that professional support when they could benefit from it. And I think AI digital counselors or bots or whatever they end up being, again, could provide a really interesting role for those people that might otherwise need to wait till they're further down the path of mental health problems to take that step to see a clinical professional. So there are some of my thoughts on it. I can see you nodding away. So hopefully that's given you lots of food for thought as well. But what are your thoughts?
I guess interesting to hear from what Tom thinks from a policy perspective of how do we navigate that? How do we navigate such a complex, such a complex health issue as mental health, with the integration of chatbots, AI, technology? What are your perspectives on that?
I mean, it's you just kind of perfectly summarised the complexity of it, and a lot of survey work at the Health Foundation to understand what the public and staff think about technology. And as part of that, we've looked at AI and acceptance for different kind of forms of AI. And I think what we've seen across the board is that um, acceptance or support for technology is so context specific. Depend on the person using it and their characteristics, how it's used, their experience of technologies in the past, um, and there may be some circumstances where people find chatbots more comfortable because they just feel more able to disclose personal information to a computer than to a person. For other people, they may feel less comfortable. So then you're in a situation where, how do we tailor the approach to those different preferences? Because we might not be able to do that for everyone. That's quite tricky. I'm not sure we've bottomed that out. But I think, if we have the right safeguards in place that mean that we're only developing and implementing technologies that are safe and effective in the right circumstances, then there may be a role for chatbots in helping people that require support. But I think what we're seeing at the moment is, particularly with large language models, is almost a wild west where people are able to get the kind of advice they get from a clinician from a model that's not gone through stringent regulatory requirements, and that is problematic and can cause harm or death, as we've seen through this article. So I think we need to get better at regulating some of these new technologies like generative AI, and making sure that the right safeguards are in place to avoid these sorts of terrible situations we're seeing in this article. But I think another thing to just kind of draw out is a tension between the obvious imperative to try and fill these big gaps with technology, and actually what the public are telling us through our survey, which is kind of UK wide, it's nationally representative, it's quite a big survey, so it shows us what a lot of people are thinking about technology. And actually, they tell us things like, you know, they will not support AI in decision making if the results are not checked by a human, you know. But if they are checked by a human, support jumps massively. They've also told us that the human dimension of care is really important within technology. And the biggest concern, or the majority of the public and staff that we survey, feel that AI is going to make them more distant from each other. So, on the one hand, we want to fill these gaps of technology potentially. On the other, people are telling us that the human role, or human interaction is really critical. And so, how do we bring technology in that doesn't constrain or diminish that human dimension?
I feel like that's why we see so much technology with the intention of reducing the workload on clinical professionals, because it's kind of that perfect middle ground of using technology to solve a problem, but basically freeing up that time for more of that really valuable in-person interaction stuff. I know that's difficult in the mental health space because there's not many people. It's a numbers game of people that are able to offer that support, which is one of the reasons waiting lists are as long as they are. So yeah, you're right. It's a really, really, really big challenge and an interesting one.
Also quite a maybe meta point, but also looking at things in a larger scale of where we are with mental health, and the impacts of technology itself
Mm.
on mental health, like social media. Young people, we're seeing incredibly increasing rates of social media, of mental health issues in young people, and what impact that's having, and the strain that that's putting then on this. So it's quite an interesting and complex area to look at it, technology's role in this, in the problem and potentially the solution.
I
Um,
find as well, I've seen it lots in the news recently of, or maybe not even in the news, I've also seen it a lot anecdotally of people training ChatGPT to be their own kind of life coach and day-to-day support. And you've got people sort of leaning heavily on that in their day-to-day life to just sort of ask basic questions and advice, of questions you would have typically gone to friends or acquaintances for. But people are leaning on models for that. And it's interesting because, yes, there's a world open to you of data that embeds that maybe is outside of your initial environment. But we know how isolating those things can be. And we also know that models are trained to show you what you want to see and what feels human. Like a ChatGPT's end goal, let's not forget, is not to provide accurate data, it's to provide human-like responses.
mm,
It's a very different thing.
yes, I mean, only last week on Pigeon we were talking about Mark Zuckerberg's call for AI friends and that stuff. So it seems to be a running theme at the
Mm.
moment. You know, this where is this what kind of direction is this taking us in as a society if we're replacing those human connections with technology, and where's the role and where's the line? And it's interesting to look at this in the context of healthcare as well, and I think rightly so, having a degree of caution about how it's used, but also at the same time excitement about how it can potentially help. So mixed feelings basically. Don't know how you guys feel. Um, well, I think that leads very nicely actually onto our final story. The final story of today's episode, which is published in Healthtech Digital, and it's about digital inclusion. Title: Under the Microscope, as Digital Poverty Alliance launches NHS sector inquiry. So this piece is very interesting as it brings up digital inclusion and inequalities as a key theme. And in light of our discussion today about, the amount of funding that's required to shift the NHS, and also that conversation we just had around AI chatbots and how to implement technology in ethical ways, I think this highlights some really interesting themes around that. How do we undergo a digital transformation that's fair and that's going to be equitable and not leave people behind? I know, Tom, you mentioned some work that the Health Foundation has already done on looking at attitudes of different groups and people who are adopting technologies. So really fascinated to hear what you think about how do we make sure that digital transformation is not leaving groups behind, and what are the key issues to consider?
Yeah, I mean, it's such an important topic, isn't it? As healthcare becomes more digitized, it's going to be really critical to ensure that it's as inclusive as possible. But I mean, clearly, there's a lot of work still to do, and this inquiry into digital inclusion in healthcare is really timely. Um, so, I mean, there's a few points that kind of jumped out to me in the article. I mean, as it said, part of the challenge is about digital skills. And I think the Good Things Foundation, that do some really good work on this topic, found that around 8.5 million people in the UK still lack basic digital skills. So that's one challenge. But it's not just about the skills, it's also about access um, to digital technologies. So this includes things like, being able to buy the tech that you need to access services, whether that's a phone or a tablet or a smartwatch or whatever that tech is. And then related to that, you need to be able to afford the data. And we know that's an issue as well. And again, from the Good Things Foundation, um, they found that around 2.4 million households in the UK can't afford their phone contract and a data plan. That's pretty significant. And so, there's a whole raft of challenges around like how you actually design the technology as well that we could get into. But there's a big issue around kind of skills and resources to be able to access the tech that you need to benefit from digital healthcare.
Really interesting. And yeah, it's almost easy to forget that data and the internet costs money because we use it all the time, every day, to do everything. And actually, there is some significant, um, you know, s- like aspects required to kind of access that, which is really interesting in the context here. Um, what do you think are the key things that I guess policymakers need to consider in making sure that those groups aren't overlooked? Is there more attention needed on this area?
I think there's been a really good focus on health inequalities, and I think this was kind of catalyzed by the experience of COVID, which really kind of highlighted big health inequalities in society. They've actually existed for a long time, but I think they were really underlined during COVID. And so after that, we've seen, I'd say, more of a concerted effort from policymakers, including people at NHS England, to try and tackle health inequalities. And we've seen a bunch of initiatives like Core 20+5, and the AI ethics initiative as well was something that we were a part of, that was trying to tackle health inequalities, and reduce that gap. So, and I think there were a bunch of actions that could really help reduce health inequalities and ensure that digital technologies are inclusive. I think the start point really is the design bit, right? So, and then so this brings in innovators, whether that's private sector innovators or NHS innovators. They need to start by making the technology inclusive by design. So that's making it easy to use, making it as accessible as possible. So, might be creating a simple interface, giving different language options, tailoring content to the groups that you're aiming the product at. And so then from a policy perspective, it's about how do you stimulate that? So providing guidelines and standards that people that are designing health technology need to meet to make sure that it's inclusive. But there's another element that relates to this, which is about public and patient involvement. Okay, so getting people involved in the design and development from the beginning, so that development is better informed by the lives of end users, their needs and their preferences, and importantly, what kind of challenges they're facing when it comes to improving their health. And again, I think national policymakers can provide guidance on what good looks like, and maybe stimulate the development of the capability within the NHS, where innovation is coming from the NHS, to do this better. But what I would add to this is, there's loads of really great examples of where this is happening on the ground, and lots of different organizations that are working on improving digital inclusion and focusing on how digital technology can reduce health inequalities. So I think we have a good platform to build on, and keep improving.
I've got one question. Just you probably don't want to name any names, but it just popped into my head, and I'm intrigued. Can you think of any examples where this hasn't been done very well? Like, is there any examples where either we can think of tech that's been adopted or been implemented where it has excluded people and it hasn't worked very well? Probably not able to answer that, and I'm which is fair enough. But I was just intrigued to see if we could talk about the flip side.
For listeners, pensive thinking face.
Also fine if not. We can. I'm sure we can circle back on this at another point. But Belle, happy for you to jump in with some thoughts as well. If
Yeah, I
while
guess
Tom
while he thinks.
he thinks if his bosses will allow him to say that.
Yeah, I guess it's such an interesting topic, and it's such a vital one. And I think some of the examples of kind of digitally excluded groups that they include in the article are older people who are less digitally literate, as Tom, you've just described, people with English as a second language, but also people who are rural. I come back to this a lot, mainly because I grew up in a rural area. And so I'm very aware of the differences between access to any sort of healthcare between rural communities and cities. Just because your doctor's is so far away, your nearest hospital is so far away. And then when you do get there, you can't assume that they're going to have the same facilities as a well-funded city hospital or GP or whatever. So that's one that I'm like constantly aware of, because there's the actual access to healthcare challenge, and it's making sure that digital healthcare interventions try to reduce that gap as well, rather than add even more inequality, because we know they cost money. We don't want them just to go to the well-funded city councils. We need to ensure we're seeing rollout across the UK. Now, again, I think from a policy point of view, it's ensuring that we are, like you just said, working with those innovators by design, working with people on the ground to ensure that they're connecting in with NHS, like ICBs and boards across the UK, rather than kind of focusing on specific areas, ensuring we're seeing rollout of that. Maybe utilising community care services. So instead of people having to go to a specific hospital, there are other locations they can go to use certain technologies or things like that. I think there are lots of opportunities there, but it's the thing that always sticks out for me, just because I'm very aware already of the barrier that already exists. Like where I grew up, the nearest hospital was half an hour away. They've recently, well, years ago now, closed their maternity ward. They've also recently closed their A&E ward. The nearest hospital is now an hour away to go to A&E or to have a baby. Like those things make a real difference, and they add a real barrier to care for people that need to seek support. So I just think that's something which I'm really interested to see, and hopeful that technology will help close that gap rather than exacerbate those problems.
Yeah, I mean, just to jump in on that, I was just thinking, are there probably are specific examples. I mean, I'm not going to pick any out, but kind of stand back a little bit and reflect on the evidence more generally. I mean, we did a piece of work a few years ago, which was um, basically a review of the literature of what it takes to design and implement technology effectively. And there are a bunch of papers in there that said where the entry point is too difficult, then people just end up not using the technology. So, if it's too hard to use and they don't have the right skills, or it's too hard to sign up for, if it's an app, too hard to kind of create a profile and log in, or they don't have access to the technology, then and it's going to fail. And there are plenty of examples of where that's been the case. So I suppose in those circumstances, you'll have an issue where somebody's not using the technology, and that's not great. But I think there's some more serious considerations when you think about how technology is actually designed and the data that it's based on, particularly now with the proliferation of AI and other data-driven technologies. You know, if the training data is largely um, made up of data that relate to white men, and then that's being used to develop a model that's used for women of color, then you could have some really poor outcomes that could include harm. And again, there are examples of that. I won't pick out any specific ones, but um, I think we need to be talking about the data that these technologies are based on and making sure that that is representative of our communities that are ultimately going to be the users of these technologies. And really, we want everybody to benefit. I mean, it's not cannot be the case that technology only benefits certain groups in our society. So there's work to be done there. But the good thing is that there is stuff happening to sort that out. And the University of Birmingham released some really good standards for building more representative data sets to then use to train AI technologies that will then lead to better outcomes for the people that use them.
That's a really incredible point, and I think a really nice note to kind of round up and end the discussion on. Including that viewpoints, data from all users who are going to be using this technology. Um, and I know the Health Foundation is doing a lot of work in this area. So, Tom, thank you so much for your thoughts today. I thought it was a really interesting discussion. For those interested in reading the Health Foundation report, you can find it on the website. Tom, is that the best place to
LinkedIn
find?
Pigeon, Amy.
Oh, it's LinkedIn Pigeon as well, and also on the website. You can't miss it. You can't miss it. Yeah, it's a really detailed and interesting report. So do recommend you read it. So thank you all for listening. Thank you, Belle. And as always, you can check out the best stories of the week on Healthtech Pigeon and Biotech Dodo. And don't forget to like and subscribe. And we'll see you again soon. Thank you.
Thank you so much.
Thanks a lot.
Bye now.